pleasure to have everybody here. My name is Rick Gould. I'm an attorney with the law firm of Couzens, Lansky in Farmington Hills. We're a full-service commercial law firm. Also help with people with estate planning and tax planning. And part of being an attorney, aside from talking a lot and writing lots of documents, is to stay up on the law. And we had the Health Care Act. It was adopted in March of 2010. Some things went into effect right away, some things over time. As we go through a lot of this, there's one thing you'll notice, and that there isn't a whole lot that goes into effect in 2012. Anyone want to guess why? It's an election year. Not just any election year, a presidential election year. And in fact, today is January 20th. And speaking of presidential election years, it's always challenging when you speak on January 20th, since that is, since I think 1937 with President Roosevelt, January 20th is Inauguration Day. So there are lots of great words that have come out from presidents, from President Kennedy to ask not what your country can do for you, but what you can do for your country. So as a speaker, it's always challenging to speak before an audience and know that on this day some great words were spoken, and hopefully you'll focus on the issues, you'll walk out enlightened, and if I do happen to come up with something that's really, really good, please let me know so I can take advantage of it, and we'll see where it goes going forward. One quick little story is that as I was preparing for this presentation and shuffling notes around, we had kids come over from our neighbor. Their babysitter got sick, couldn't watch them. The little kids love Legos. My kids, who are older, still love Legos. So they were playing. I was sort of watching, but I was getting stuff done. Had my legal pad. I'm writing notes. I'm sort of figuring out slides, moving things around, crushing things up. And I got a call on Monday saying, "Eric, what in the world were you doing when my kids were over there?" I said, "What do you mean?" And they said, "Well, the kids came home and they asked for paper. They were scribbling, coloring, crunching things up, throwing paper all around. And when we asked, 'What in the world are you doing?' they say, 'Oh, this is how Mr. Gould makes money.'" So with that, at least there's a little humor along the way. So first, there's been a lot that's said, and my purpose here is to bring forth information, to talk about what it is, and to at least give some insight. But my role here is information, but not taking a position. But I felt it was really important that we at least take a couple minutes and we look at why in the world did this proposal even come up? Why did it become law? Why were people concerned? And what does it mean to us? So let's look at a couple reasons for the law and what it is. So we have an issue. And that issue is that if I have health insurance, there's a certain amount I have to pay, there's a certain amount the insurance company pays, and the insurance company collects premiums for that. If I don't have any health insurance, then I go to a medical and I need medical assistance. I go and I will pay something out of my pocket on my own. One of the challenges is that as an individual, I don't have the ability, the power, as a large organization. I pay whatever they charge. The interesting thing is that if I have insurance, I actually pay less. So I can present myself with the same condition, and if I don't have insurance, let's say the charge is $200, but if I do have insurance, the actual charge that the medical professional charges is maybe $100, is maybe $80. The insurance company pays less. And as a result, as time has gone on, we've seen that it results in a dysfunctional and high-cost system. Things don't make sense, at least to the average person. There are all sorts of rules that are lurking in the background about how much has to be paid out, how much is allowable to go for administrative costs, how much must go for patient care, and the law is going to change some of that. As a result, as time has gone on, those without insurance have had a smaller amount of access to the care. Doesn't mean that they don't need it like anybody else, but the accessibility has changed. And the bottom line is that even though this past couple of years, when we talk about the cost of living increase on a global basis, it's gone up a little, but not tremendously. There's certain things that go up tremendously, way above the cost of the rate of inflation. College tuition is one of them, and healthcare costs are another. So we have this law, and the intent, at least as best that I've been able to learn it, there's been a couple things about the law. Let's try and establish insurance. Ideally, employers have the ability to do that, but when we say that, who are the employers? Well, we can think of large corporations, we can think of governmental agencies, and then we can think about the biggest part of businesses in America, and those are the smaller businesses. They create a lot of the jobs, they are the big employers. Do they really have the ability to pay and provide the type of insurance that's necessary? Some yes, some no, and as costs continue to go up, it becomes fewer and fewer. So, because there is a working model, the goal was to start with a core and then work around it and try and, if there are rough edges, try and smooth them and try and build something up. The other thing is that, getting back to that individual, as a group, we can all, let's do this. I'm going to say a word. Help. No, just help. Now, that's me saying the word. Now, I want everyone, in fact, I want this table, when I say three, say help. 1, 2, 3. Help! Now, the group together. I count to 3. 1, 2, 3. Help! Oh, come on, you can do better than that. But still, the collective help was still louder than the one help. And that's one of the concepts behind this, is that if it is very expensive or maybe cost prohibitive from us, and each of us may have some health issues or may not, but collectively as a group, we can spread the risk amongst ourselves. That's the basic concept of insurance. Whether it's health insurance, life insurance, long-term care insurance, heirs and omission insurance. Where's Karen? Karen. Auto insurance, property casualty insurance. That's the basic concept of insurance. And health insurance is no different. So what if we try and collectively establish these pools or these groups? If the insurance companies aren't going to provide the groups for us, or they're going to assign the groups, and they're just going to deal with this individual insurance product, what about a collective group, a greater incentive to create a pool that we can spread the risk across and perhaps control the costs of it? That's one of the intents of the new law, is to create new markets for health insurance. It doesn't get talked about a lot. What a great idea. Yes, there's all sorts of rhetoric going on, but here's an opportunity. They're actually looking to create new markets and make things more affordable. There are issues regarding low-income individuals. There are issues regarding who's covered under Medicare, who's covered under Medicaid, and can the system continue to support it. But at least use those for what they were really intended to be at the very beginning. A safety net, a floor for coverage for low-income individuals. Try and at least slow or reduce the constant increasing cost of health care to try and keep it affordable, and provide coverage for preventative services. That's one of the things that also, I think, gets overshadowed, is one of the goals behind it was recognizing the fact that many people, even within the traditional health insurance philosophy, you get covered when you are sick. But if you're sick, it means you need it, and perhaps there might be opportunities to do things ahead of time where, yes, there are costs that you don't incur when somebody's sick, but the costs may be lower and less than when someone is sick. Which is better, to wait and wait and wait and then present yourself with all sorts of medication, all sorts of treatment that you need, or to go ahead of time, perhaps once a year, have a checkup, and take some action and get some professional advice as to how you can prevent getting sicker. As to whether that'll work or not, we'll have to wait and see. But that's one of the intents behind it. Another intent, and this has actually happened so far, is the elimination of lifetime limits. I have a good friend whose daughter, unfortunately, developed some complications in her infancy. And at the time, my employer had insurance coverage and it had a limitation of $1 million lifetime. Unfortunately for him and his family, they were already at risk for not being able to continue health insurance for their, and they were relatively a young couple. I know young is a matter of perspective, but they were in their 30s. And so they were very likely to blow through that $1 million of limited coverage very quickly. And what were they going to be able to do? Fortunately, the firm was kind enough in recognizing that and wanting to do something. They went to a policy and increased the limit so that that family actually had an opportunity to do so. It was very generous of the employer. Not all employers are necessarily going to do that, especially as the size gets larger. The law now says there are no lifetime limits. We had issues with how do you cover children? Well, we know that when they're minors, the parents are responsible till age 18, in some states 19, maybe 17 or 16. And continuation on, if they were students, and it depends on how you define students, they could qualify for coverage for an additional period of time. But why were we penalizing those who had children that stayed in school as to those who started getting involved in the economy, getting jobs, getting full-time jobs, and shifting the burden all on them? Especially when, generally speaking, children or young adults, their cost of insurance is less because they're generally healthier. And I think it's fair to assume that while there are always conditions and diseases that strike, for the most part, the younger you are, the healthier you are. And so now we have the law that basically says, regardless of your status, whether you're a student or not, and I remember for a period of time, I know in Blue Cross in Michigan, they would make determination for coverage of children as to who claimed the dependency on their tax return. And it had nothing to do with whether they were student or their age. One of the interesting things to note is that the law, while it defines a whole lot of things, does not define benefits and what specifically must be provided as to a particular benefit. Okay, another point to note, Medicare Part D. Another crazy thing in the system, Medicare Part D, that is for people who want prescription drug coverage under Medicare. Once you turn age 65, you're eligible for this. It was a really weird system. You had the first certain amount of dollars for prescription drug costs. You were responsible for the whole thing. Then there was a layer of healthcare coverage, drug coverage, where the participant paid 25%, Medicare Part D paid 75%. Once you hit this amount, and I think it was around $2,500, you then had responsibility for 100% of the cost again for drugs until you got up to like $5,000. And then the system would pick up most, if not all, the cost. It created what's called a donut hole. So you had coverage, you picked up a bit, coverage got better, and then it was actually zero coverage, and then expanded coverage. One of the things that the law does is it, over time, will eliminate and get rid of this donut hole. And during this phase-in period, there was cooperation with the pharmaceutical companies so that individuals who are in that donut hole situation, having to pay the full amount, the companies have agreed to work out a system where, in essence, the individual will have to pay half the cost of that drug until they reach that point again where Medicare kicks in.